While I make every effort to broadcast correct information, I'm also still learning. I will double check all my facts, but realize that healthcare is a constantly changing science and art. One doctor or healthcare provider may have a different way of doing things from another. I welcome any comments, suggestions, or correction of errors. I take no money from supplement or device companies. By listening to this podcast or reading this blog, you agree not to use this podcast or blog as medical advice or to treat any medical condition in either yourself or others, including but not limited to patients that you are treating. Consult your healthcare provider for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast or the website. Under no circumstances shall any guests or contributors to the podcast or blog or any employees, associates, or affiliates of the Boss Body podcast be responsible for damages arising from use of the podcast or the blog. This blog or podcast should not be used in any legal capacity whatsoever, including but not limited to establishing the standard of care in a legal sense or as a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast or the blog. What's up, guys? It's Dr. Tim Jackson with another episode of the Boss Body Podcast. Today, I have with me a husband and wife team, Josh and Katy Whalen. Katy has had a long journey through infertility, miscarriages, IVF, and finally giving birth to her little boy that left her feeling fatigued, hormonal, overweight, and struggling with brain fog. She searched for a holistic solution that would help her feel like herself again, and that's when she learned about hormone optimization and peptide therapies. The only problem, they were so hard to come by. So after both she and Josh began experiencing amazing results with both peptides and hormones, she knew she had to share them with women everywhere. Josh runs the men's side at Blokes.co, and Katy runs the women's side at ChooseJoy, JOI.co. Welcome to the show, guys.
Thanks for having us.
Thanks so much.
Yeah, so let's just jump right in. Tell us a little bit about how long you've been on this journey and how you kind of got started with it.
Yeah, I mean, so Joy has been around for just a year. We were a year in March, and we started the men's line actually sooner. So Blokes launched probably 6 months sooner, and that was all. I was the catalyst. Basically, I threatened Josh with divorce, and I'll let you say why.
Yeah, no, that is true. Katy threatened me with divorce, and I found out through that process that I should get my hormones checked. And I was on the opposite end of where I should have been. I was in the very low 200s, which is a pretty low score for a guy in his 30s, and probably equivalent of like a 60-year-old man. And went through the process, went and saw a couple different primary care docs who, looking back now, gave me really poor advice. And I finally found a physician that specialized in hormone optimization, and it changed my life, and it saved our marriage. And it was a lot of the common symptoms, such as low sex drive or no sex drive in my case. Body composition had changed. Brain fog was at an all-time high, drinking 12 to 14 cups of coffee a day just to get through the day because I had no energy, let alone have the drive to work out or be physical. So I've been an entrepreneur in healthcare for last 10 years. I've been in healthcare for 15 years. And not only did I see an opportunity for myself personally, I saw an opportunity in a professional sense to bring this to more men and make it more accessible and make it easy and not lose the clinical efficacy behind it. So.
Absolutely. So tell us a little bit, Katy, about the women's side and what you guys do, and then we'll go back to Josh.
Yeah, so we really focus on a few things, and that's perimenopause and menopause for women, hormone balancing. We believe in labs. We do some really deep dives and comprehensive labs, and then we also do something cool called peptide therapy, which has helped me personally a lot. So that's something I'm pretty passionate about.
Absolutely. Yeah, and so is there a specific age range? I know you said perimenopause, menopause. Do you work with any younger women since we're seeing more and more younger, both men and women with hormonal imbalances?
Yes, absolutely. I mean, I think that there's we're seeing a lot of people with gut health issues too, and that's really big. There's some really cool gut health peptides, healing peptides, inflammation peptides. Um, there's a lot of, there's some great weight loss peptides on the market right now. So it's all ages. I think that, what we do screams for the person that really notices maybe something is off and really wants to take care of their health. So I think that's, our sweet spot is someone who's in their mid upper 30s, who's going, something feels different. Maybe I haven't changed anything, but my body just feels off, or my brain feels off, or my sleep is off. So it's someone that really is like looking to change that feeling and take control of their health.
Awesome. And Josh, is it the same for the men's side with Blokes? Or are we looking at,
Yeah.
men in their late 30s starting?
Yeah, the reality of where we are as a country and just our health, it's the age continues to get younger and younger in terms of who we're treating. But if we had a sweet spot, it's somewhere probably between 35 and 60, because a lot of those changes have started to take place. Also, disposable income, because not most of this is not covered by insurance, as you're aware. And we're fortunate that these are just human hormones, and it can be treated equally as effective with men and women. Just focus on different, maybe, parameters. Like women are, will dial in progesterone and estrogen, where men were really primarily focused on testosterone. But the peptides work both with both sexes and work really well.
Awesome. So what would you say are the top in terms of most efficacious and most popular peptides for both men and women?
Well, I mean, right now the weight loss peptides are hard to ignore. They're having a moment right now. There's a lot of people on them. There's, a lot of good things about them, some controversy out there, but in general, people seeing a lot of success on those. And that's, obviously a subject that the US especially struggles with. So that's one of our top sellers. And then for women, we see a lot of women in kind of perimenopause area. So just talking about progesterone and testosterone is also pretty popular.
Awesome. And for men,
Yeah.
what would you say?
I think the tried and true testosterone is still a phenomenal therapy for men who are suffering from low T symptoms and or hypogonadism, or showing that from a biomarker perspective. I think testosterone gets a bad rap in society, but I think it's a miracle therapy. And then, like Katie said, the GLP-1 category of medications are having a moment, and they're having a moment for both men and women. And the reason why they're having a moment is because they work. They're very effective at controlling appetite, controlling cravings, reducing A1C, reducing BMI, waist size, all those things that people have struggled with for so many years, and finally giving them an edge when it comes to managing, their weight.
Right. Absolutely. So let's talk about performance enhancement with peptides. A lot of people hear performance enhancement, they think anabolic steroids, but we all perform at something, whether you're an entrepreneur, a doctor, accountant, it doesn't matter, a parent, you're going to perform at something. So from a cognitive standpoint, like a nootropic standpoint, what are the most popular peptides that you guys see or use?
Yeah, I'll let you go because I know that's one of your favorites.
Well, yeah, we dabble with a nootropic peptide called Cmax. It gets past the blood-brain barrier, so it's effective and quickly. Was developed many years ago in Russia, and it's just been what I call my cheat code in life. It just makes me feel extremely connected to my mind. Feels really connected to my cognition, my memory. It's like one of those things that you give a dab before a meeting, and you're just flowing. So that's been one, but I think people underestimate the value that even testosterone plays mentally, especially when it's over a long period of time, or a chronic aspect, has really, your testes have stopped producing, and ovaries, and the receptors in the brain are extremely powerful towards that. So we even see, not from a nootropic standpoint, but we see a lot that is solved just by having optimal testosterone levels in men and women when it comes to brain fog or mom brain.
Yeah, I think a lot of people forget, like even with my own mom, you can't treat your family. So she goes to another clinician, and well, she was going to a different one, and her testosterone was, at the very bottom. And she has osteopenia. I said, well, aren't you
Mhm.
going to right for some testosterone? Oh, I only give that to women who want to be very, very sexually active. I said, well, what about heart health and brain health and bone density? Oh, I'll have to research that. You guys run into that a
Yeah.
lot?
Very, very sexually active. I mean, I don't think that that's like, I think that's a funny myth, I mean,
Yeah.
it's very helpful for libido, but I don't think it, at an optimal level, which, I have now, I wouldn't say I'm like very, very sexually active. I think I'm like fairly normal, like
Right.
healthy.
When I mean,
Absolutely.
and then to that point, like, what is wrong with being very sexually active? I mean, we know that the practice of sexual encounters is good for the body, it's good for the mind, it's good for your endorphins, it's good for your heart rate, your blood pressure. There's so many good things about it. So yeah, no, it's funny you bring that up, because I feel like sometimes we're having to educate other physicians and in the medical community about the beauty and the power of testosterone. I just think it's got such a bad rap, from the 70s and 80s and 90s with the anabolic phase and bodybuilders, and probably the baseball era with McGuire and Sosa, which were the most fun years. But and I think on the other side, I think women have been neglected when it comes to hormone optimization, specifically with testosterone, because it's such an effective tool. And you talked about osteopenia and osteoporosis. That's a massive direct indication to low testosterone and loss of muscle mass and fitness and all that. So
Well, I think also for women, like, wouldn't you say for osteopenia, like that estrogen plays a major role in that as well?
Yeah,
Yeah.
estrogen, progesterone, all the minerals, vitamin K2. And, still I hear people say, oh, take calcium. And, if you don't have that transport mechanism with K2 for calcium, you're going to take it to the wrong place. And that's not a good thing.
yeah, no, totally.
Yeah.
And so do you guys work with a lot of couples? Because I end up treating a lot of families, because if you optimize one person, and let's say you're optimized, you're not, and you're yelling and screaming at him all day, and all he did was say, hi, Katie, that's obviously not going to work out well. So do you guys end up
Yeah.
working with a lot of families?
I mean, we think, yeah, we think that's so important. And that's exactly why we did both of these businesses. I was yelling and upset with him for a while, for a couple years when he had no libido. But then after I was finished having my kids, after my second baby, like all of a sudden I had none while he was feeling way better. So the tides had, changed. And all of a sudden I felt like bad for how I treated him, because I now knew what it was like to have no libido. And it really, you just don't care. You're like, I'm fine. I'm not interested. Like, you don't think about it.
Yeah,
So
right.
then he's like, wait a minute. Like, so we think that it's very important to optimize both people. We think that we save marriages, it saved ours. And, working on your health together is super important, because you want to live a long, healthy, happy life together, and close that gap between health span and lifespan, so that you can enjoy, the end of your
Yeah.
life.
And, if you're cooking and you have to cook a healthy meal for yourself and an unhealthy meal for someone else, then there's a divide there. And so you're constantly, butting heads. Plus, it determines how you show up in life, whether you're fully present or not, your business relationships, your personal relationships, all those things that you guys know. So, yeah, that's why I end up working with a lot of families. Sometimes I'll start with the kids, and then mom and dad jump in, or I start with mom and dad jumps in, etc. Are you guys seeing more and more patients that are extremely well educated in terms of their health? Like they're not just coming in and they're just going to accept whatever you tell them. Like they might challenge you a little bit.
Yeah,
That's a good question.
it is a good question. I would say yes and no. I mean, we get a whole kind of unique blend of our population. You have, you know, the likes of a biohacker who's very educated. Um, we even get the bro science guys where you know they've learned everything in the gym. And then we have a lot of people who've never even heard of a peptide, barely know what testosterone is, other than maybe, you know, reading about it in some newspaper article. So, you know, we try to provide a service that not only is very, you know, physician, nurse practitioner friendly, but we offer coaches to help bridge that gap, because sometimes there's a lot of, you know, level setting in the space and in health and wellness before you can even start having some of those more, call it, in-depth conversations.
Absolutely. And how many states are you guys in, or do you have providers in?
We have providers all over, but we are licensed in all 50 states.
Okay, awesome. So if someone's
Yeah.
listening and they're in Montana, that's not going to
Yep.
preclude them from working with one of your providers.
No, we good, bad, or indifferent. We were really aggressive about trying to get our license as quickly as possible, and you know that can be an arduous process. And you know, it's made a huge difference in our marketing, because you know, the likes of social media doesn't, you know, discriminate where those are going to be, you know, those outlets are going to be. So it's really helped our business. It's helped our patient population just by giving more access. And you know, it's nice for a smaller group like us, because then we can start competing with the Romans and the Hims and the Hers of the world, even though we're not the same. But you know, these companies who are well into the billions from an evaluation standpoint.
Absolutely. And so would you say that do you guys have doctors and nurse practitioners and other healthcare providers who work directly for your company, or are they mostly independent contractors with their own practices?
Both, both. Right now, we're kind of running a blended model. It depends on the candidate, depends on the need. I would imagine over time we're going to start. You know, our business is so much different than so many telehealth practices. Knowing hormones, knowing optimization, functional medicine. It's a niche still. It's not a primary care service. You know, so we play a very hands-on role. Our physicians who are doing the training play a very hands-on role with the individuals that we bring on that maybe don't have that experience. So we have found it to be somewhat of a hybrid, and a lot of it just comes down to who that talent is. As you can imagine, you can teach, you know, a lot of people what we do, but it's hard to find that right person that has the right bedside manners, that can communicate to patients clearly, that can get on their side of the table and help, you know, adjust their health.
Absolutely. Yes. And so from a cost standpoint, if someone wants to get started with you, just a rough idea to get in the door and get going, how much?
We try to make it pretty flexible. Right now, we're on a subscription and a la carte model. There's a lot of people who want to just kind of experiment, and we'll allow them to do that with the a la carte aspect. And then our hormone plans start at $149 a month, and that includes all your labs, that includes all your consults. Most patients are getting somewhere between 4 and 8 labs and consults a year. So we find it to be pretty competitive, and our focus really is on the lifetime value of that person.
Absolutely. And do you guys have a particular, I don't know if you're comfortable mentioning it, but source for peptides? Since TaylorMade, you know, kind of got raided a few years ago and some of the peptides taken away, you guys have a go-to source for your peptides?
We do. We we're pretty passionate about the peptides we source, because we take them ourselves, and you know, we become the guinea pigs of all these new therapies. That said, we work with about a half a dozen compounding pharmacies throughout the country. TaylorMade is actually still one, and you know, they had a bad rap with the equine aspect of their business of being in Kentucky, and But they still make great quality products. And we work with a handful of others that are really an inch wide, a mile deep when it comes to peptide therapy. But the one thing we don't do is we don't work with anybody unless they're a US based compounded pharmacy regulated by the state board of pharmacies, along with buying and sourcing their ingredients from FDA approved facilities. Testing is part of that as well, whether it's potency or sterility. Those are all very important things to us.
Absolutely. What would you say outside of the GLP-1 category and weight loss peptides? What would you say the next most popular category is currently?
Yeah.
I think it's probably my favorite. That's the GH releasing peptides. We do a lot of sermorelin, and I personally love it. We have, either it comes in injection form or a troche form, and I currently do the troche form, take it at night before bed, so it helps me kind of boost my growth hormone production while I'm sleeping. And I think that's, one that I tell all my friends to do, because I think for me, it just feels like a little bit more vitality. It helps, my skin feel firmer. And I notice that I can work out more, like I'm not as sore the next day. So I think that it's just like a great overall one for kind of energy and feeling well. But
Absolutely.
I would say that's one of our more popular after weight loss.
It's not only is it our opinion, it's proof in the numbers too. I mean, we have a society that is trying to age differently and feel, like they have more vitality. And, big topics right now are health span and longevity and what that means to some people. And these therapies fit right into that. And I believe that GLP-1s are in that same class of longevity and vitality, and not just, one trick pony with weight loss or
Are
type 2
you
diabetes.
guys, do you get any requests or do you use NAD plus injections or troches?
Yeah, we do a lot with NAD plus. We do a lot with vitamin injections, NAD plus, vitamin D, vitamin B, glutathione. We even mix some of these amino acid injections that are safe and very effective. But yeah, that's another portion of what we do, just from just an overall feel better, look better type scheme.
Yeah. I personally do the NAD injections once a week, but I've never actually tried a troche. Have you tried that?
I haven't tried the troche, but I tried a sublingual. My friend, she hasn't released it to the public yet, but it's a CBD NAD plus mixture. And I
Oh
took it
wow.
for the first time right before I went to the airport. You know how it's so hectic there. And I was just like zenned out, like nothing bothered me. And so
Oh, wow.
I also have a colleague who does the NAD plus patches on her upper arm. I've done the IVs before, when I was coming off of a medication. And, when you're doing it for that reason, you can't miss a day. You have to do it 10 in a row. But I've seen it
Wow.
work some pretty miraculous things. And one thing that's kind of counterintuitive for most people is it helps your sleep. Normally you think, oh, well, if I take something for energy, it's going to keep me up. But sleep is such an energy intensive process, especially those first few
Mm.
hours. You're detoxifying so many compounds and molecules. So NAD plus really, I mean, better. It's just like the transcranial photobiomodulation device. It's charging the battery in your brain. And, if you can do that in all your organs and organ systems, everything's going to work better.
That's
Couldn't
So
agree
awesome.
more.
Yeah.
in terms of the gym market and working with athletes, do you guys have athletes, whether there's weekend warriors or pro athletes, who are approaching you for what they can do to enhance their performance and enhance their career?
Yeah, the short answer is yes, all the above. When you start talking about pro athletes, you start dealing with performance enhancing drugs and USADA testing. So it's very limited in the scope of what we can do when it comes to the peptides and hormone replacement. But it fits right into our diagnostic lab category, where we do very heavy, comprehensive blood panels that can look at every aspect of your body and address those with supplementation. We had an athlete recently where we had to get on a call with USADA and just talk about, some of the recommendations that these biomarkers can produce, based off of deficiencies. And but we have a lot of weekend warriors. We have a lot of former athletes that have passed that threshold of testing, and a lot of those individuals, their bodies have just changed dramatically. Their mindset has changed dramatically because they're not competing at such a level. So they go from this high to this lull, and we see a lot of depression set in, and that's where we kind of come in, is where those symptoms really start to take effect.
Yeah. So you guys said, in terms of what is 1 to 2 items that you wish you would have known, 10 to 12 years ago. What are those items for both of you?
Oh, what are 10 years? I mean, a lot, like a million things.
Yeah.
That's a tough question.
Listen, like I said, I've been in healthcare for 15 years. I wish I would have understood the value of baseline labs, knowing that it wasn't just a doctor check. It wasn't just a symptom address. It was more about being proactive and being preventative in my care. I think, I probably could have prevented a lot of my testosterone levels going from probably an optimal side range to a range of a 60, 70-year-old man. Could have saved us a lot of grief. And I think everything kind of takes shape for the right reasons. 10 years ago, if we would have been in this business and professing what we were doing, it might have been taken a lot differently. I mean, we're all of a sudden accepting longevity. We're accepting vitality. We're accepting hormones.
Yeah.
I can certainly tell we would have got a lot of pushback in the medical community. So I think there's a lot to reflect on. But for me, if I was just at that age, I would have been in my early 30s, would just be knowing the power of labs.
Yeah, absolutely. I mean, I think so many people associate, testosterone with muscle building. And yes, it helps with that. But for me, it was more just the energy, the mood stability, the cognition, the drive, the heart health benefits. As you guys know, the studies show when testosterone in men drops below 550 nanograms per deciliter, your risk of all-cause mortality goes through the roof. And yet, you see commercials, at least here I do. Oh, did your doctor prescribe testosterone and then you had a heart attack? Well, the study that they did, they took guys who had testosterone, a total T around 250 nanograms per deciliter, and they bumped them up to around 350. So just enough to feel a tad human, but not completely human. And then they had a heart attack,
Right.
and you're like, see, I told you the testosterone causes heart
Yep.
attacks.
Yep.
Oh, wow. That's
Yeah.
interesting.
Yeah. I feel like you can come to your own conclusion if you set up the study right, good or bad.
Yeah.
And when you're taking a guy from hypogonadism to basically another level of hypogonadism, well, you're not really doing much,
Right.
But you even saw that with in the beginning phase of COVID, like they thought high testosterone was causing more of it. Now they know, like, it was actually the opposite end of that spectrum. And from my just extrapolation, you look at what low T can lead to, and you realize the power and value of testosterone in the human body from an inflammation standpoint. It's imperative.
Right. Absolutely. And it affects, if I remember correctly, 2 steps directly in the Krebs cycle. So not only do you have overall, sex drive, but you have ATP at the tissue
Yep.
and cellular level, affecting pretty much every function in your body. So I think, it does
Yep.
get blamed for a lot of things, but, if I drink 2 gallons of water in 5 minutes, I'm going to go into renal failure, but we probably shouldn't ban water.
Right.
I mean, anything
Right.
can be misused, right? It's context that
Yeah.
makes it important. And I
Yeah.
think, the facts just show that, when you optimize hormones, you're taking out depression, anxiety, insomnia, skin issues. So, I'll let you draw your own conclusions, but the powers that be, anything that makes you stronger, whether it's physically or mentally, they are going to poo-poo, essentially.
Yeah. Yeah. It plays really well into the sick care model when you're sick.
Yeah, exactly. And, I tell people, they are like, oh, well, I went to my doctor. I'm like, okay, your doctor's there, for a 10-minute visit, 5 to 10 minute visit. If your hormones are, 250, if you're 1 point within the range, they're going to say, okay, you're good. No reason to write for testosterone. But yet, those people are going to be on antidepressants or in the hospital with depression, anxiety, and a
Yeah.
whole bunch of other things. So it's
Yeah.
really unfortunate. But tell us a little bit about your story with progesterone and estrogen. Did you take those yourself? Are you taking those yourself?
Yeah, I am. Yeah, testosterone was actually one of the first things I started taking. After I had my fertility journey and my babies, I was definitely overweight and I had huge brain fog, no sex drive, like I mentioned. So after getting my labs checked, testosterone was actually the first thing I tried. And it was really pretty amazing for me feeling just the motivation and like really enjoying working out and enjoying lifting weights, which I think not enough women do. And that sounds like so bodybuilder-ish, but it's not. Like I'm clearly not, too muscly, but yeah. So I just really enjoyed the motivation kind of it gave me and the kind of excitement, in my day. And then about 6 months later, I was noticing a ton of anxiety, like over the top, like what's wrong with me? Is it because I'm a mom now? Is it because, everything gave me stress and I was worrying and I was kind of up at night with thoughts racing. And I started on progesterone at that point, and I just felt an immediate kind of like calm sigh, take a breath. So I've been on that. I've been on, ever since. And I really, really think that's kind of balanced me out too. And I haven't tried estrogen yet. I don't think I need it. I'm 44. So at some point I do think I, will get on it. But at this point, I think I'm pretty balanced right now. But, I did want to say, you mentioned depression and getting on depression SSRIs. And I read something that somewhere that, women they get on antidepressants at a rate of like twice as much when they're from their 30s to their 40s. It doubles. And to me, that's like an obvious like light bulb, like just check your progesterone levels, because that helps calm us and helps ease our mind and helps us sleep. So, instead of just going right for that antidepressant, like just, check your levels and see what's going on, with progesterone.
Absolutely. So for people out there who are listening, who are wanting to dip their toes into the water, like you guys described at the beginning, maybe you don't feel like yourself, 2 years ago, 5 years ago, how would you recommend going about improving your health? What are some things they can do before they get in to see one of your providers?
Go ahead.
There's a lot. Obviously diet and lifestyle, managing stress, getting appropriate and proper sleep. That's no less than 7 hours a day, probably more along the lines of 8. And not just like trying to manage your stress, but finding the outlets to do so. Because if you're not getting sleep and you're stressed, those are a recipe for disaster and optimization and longevity. They're direct correlations to heart disease and cancer. But I think a lot of it just starts with what's going in and out of your mouth too. And are you working out on a relatively daily basis, getting some type of movement? And my new rule is just getting movement in every day with something, whether it's fitness, whether it's pushing weight, whether it's playing pickleball, something that is just going to get my heart rate up and moving. And then, doing the best I can to control what goes in and out of my mouth.
Absolutely. Well, you guys have been a wealth of information. Is there anything you want to leave listeners with?
We just urge people to just really not ignore any symptoms that come up. Don't accept like the excuses like I'm aging or I'm a mom now, so whatever. Really just like pay attention. Your body's trying to tell you something. And there's so many options out there, to just kind of figure it out, follow your intuition, and own your own health journey.
Yeah,
Awesome.
I think refine your search when you're trying to figure this out, and know that healthcare and medicine has become so specialized. And if you feel like you're having some of the symptoms that we discussed, or if you Googled them and they align with it, make sure you're finding the right provider that practices in this specialty, because hormones have become a specialty. Optimization has become a specialty, and you're probably not, and I'm not saying you won't, but you're probably not going to get that from your standard primary care internal med doc.
Right. Absolutely. Well, we're going to post all your links and websites. So we got men covered, we got women covered. So we can cover the entire family, the couples, everything. So we're going to post that. Thank you guys for being here. Thank you for the work that you're both doing. And hopefully we can have you back on in the future.
Thank you so
Love
much.
to. Thank you.
All right. Take care, guys.
Take care.
Bye.